Thank you for staying with us, and you are right in time for our health segment right here on Good Morning Kenya. My name is Vivian Ndegwa. Now, we've had conversations on cancer on this show before. We've looked at the types of cancer. We've looked at the signs and symptoms of cancer. We have looked at the causes of cancer and the treatment options available. But today, I want us to shift our focus and get to talk about cancer care and the cost of survival. How much does it cost for you to actually get treatment for cancer in this country? That is what we will be looking into as we try to find a solution to restore hope for cancer patients. And I am pleased to be joined by my guests. I will begin with my very far left. That is Eunice Wambua. And Eunice Wambua is a cancer survivor, a cancer warrior. That's the best word to use. Welcome to the show.
Thank you.
All right, and then right next to Eunice, we have Edgar Laleti. Edgar is a medical social worker, Mount Elgon Oncology and Palliative Center. Welcome to the program.
Thank you.
And then we have Nana Kilemi. Nana Kilemi is the CEO and founder, Needy Cancer Health Initiative. It's a pleasure to have all of you on the show this morning. And I want to begin with, after a cancer diagnosis. Maybe we can begin with you, Edgar. What is the journey from there? After a patient has been diagnosed with cancer, what follows from there?
Good morning once again. It's a great privilege to be in this place so that we can share the information as far as cancer burden is concerned in the current society.
Yeah.
Now, the first place where the journey starts for a cancer patient is diagnosis.
Yes.
From diagnosis, we look at the access to the care itself, treatment. We have financial burden, the treatment adherence. Then finally, all these will determine the quality of life that the patient and the caregiver is gonna live. So, in the first place, once the patient has knocked the door at the diagnosis point, as a healthcare provider, you are saying, what is the quality of life? Are these two people able to live? This is the caregiver and the patient being the victim. Yeah. So in all the process that I've mentioned, it's all about money. Diagnosis is money. Access to care is money. Treatment itself is money. Even before they start treatment, already they have already exhausted. They are now started exhausted themselves. All these will determine the quality of life at the end of the day.
Yeah.
So you realize once the patient has been caught up with cancer, we don't have, to me, I believe there is no like rich patient and needy patient. When this smoke comes, it knocks everything. Yeah, so that's the concept.
Yeah, and we'll get deeper into that because even, as you say, even with the diagnosis, it needs money itself. Doing the biopsy is not as cheap as maybe we would expect it to be, so we will get into all of that. But first of all, I would like to hear the story of Eunice Wambua, who is our cancer warrior for the day. Eunice, if you can just take us through your journey with cancer. Where did it begin exactly? From when you were diagnosed? Just how has that been like for you?
Good morning. My name is Eunice Wambua. Soon I'll be turning 50. I was diagnosed with breast cancer in my late 30s. And it has been a journey. What made me come to realize that I had breast cancer, I had just finished breastfeeding my youngest son. So when I went to the hospital, I felt a lump in the right breast. So when I went to the hospital, in fact, the doctor told me that it's because I had been breastfeeding. So I was given some antibiotics, told to go home and take the antibiotics. I took the antibiotics for 7 days. Then I went back to the hospital. They did an ultrasound and told me all was well.
Yeah.
And the doctor, having said that all was well, I went back to my normal life. And I lived like that for almost 1 year. But after 1 year, I was now curious about the calam because it kept growing.
Yeah.
But out of ignorance, I did not seek a second opinion. And that is the reason as to why awareness is very important. Because when later it became painful and went for another checkup, it is now when I was diagnosed with breast cancer.
Yeah.
Then now I started the journey of treatment.
What stage were you diagnosed
I
at?
was diagnosed at stage 2B.
And this is after you had lived with this lump for a full year.
Yes.
So probably if it was diagnosed immediately, it would have been caught at an extremely like early stage. That's maybe the first stage of it.
Yeah, that is the reason why I'm saying awareness is very important.
Yeah.
And now the worst part of our society, because since that time I've dealt with the society for some time, most people believe that cancer is a disease of the other person. I was diagnosed in my early 30s, in my late 30s. So I also felt that in my 30s I cannot get cancer.
Yeah.
Because there's a myth that people believe cancer gets the old people. But the current trends, in fact, the youngest I've seen was 14 years and was diagnosed with breast cancer. So cancer is real, and it can get anybody, any age, especially breast cancer.
So we really need to go hard on the awareness of it, you know, and just to do away with the ignorance around cancer. Just as she's saying, you know, we tend to assume that it is a disease of maybe the older generation. Some people say ni ugonjwa ya wadosi. You know, there's so much myths and misconceptions around cancer. And I'd just like to hear from you, Nana, and get to understand where exactly did you decide that you want to start this initiative that you have, whereby you are assisting needy cancer patients. Where did that idea stem from? Is there a story behind that?
Oh yeah, good morning everyone. My name is Nana Kilemi. I'm also a breast cancer warrior. I'm 4 years now in remission. And Needy Cancer Health Initiative is actually my story because when I was diagnosed with stage 3C breast cancer in August 2022, my life was at the bottom of the barrel. I was in deep holes because I had just come from a very nasty divorce and lost everything I worked for. And for sure, I stayed with the lump for 2 years. I did not just...
Were you aware the lump was there?
I was aware, and I knew there was a problem. But I was extremely scared. And I was very, very, very financially oppressed because I'm a mother, a single parent of 2 boys. Even feeding them was a problem because when my ex left, he left with everything, including a job which was feeding all of us. It was messed. So I took painkillers for 2 years and filling the lump. Not that the lump was not there. I could wake up every day, feel the lump, come home in the evening, remove my breast, hold my breast, put a kitambaa of cold water, take painkillers, and for 2 years I never slept on the right side. So when I tell people, because Needy Cancer Health Initiative is a unique organization which is run by survivors. Me being of them, Eunice is in our team, and we are 3,000 of us. But people who have had, when I say you can house someone who is sick, they understand. When I say, oh, by the way, in my house we have no food, they know. When I come and say, oh, by the way, I met this guy and he told me he can't marry a survivor because what if? And when I tell, they laugh at me and say, "Hi, Nana, to mesque your story." And when I come and tell them, "Oh, by the way, I was sacked from I have been sacked thrice because of the what if factor." Most people, the stigma is still, we are liability. Someone the other day told me, "You know what? We can't insure you because you are like a car which has a terrible road accident. So that engine will knock any time." So when I am with Eunice, with Judy, with Peter, with Moredi, with all these people, when we talk about these things, they are like, oh yeah. So this is the story behind needy cancer health initiative. I have walked the journey. It is my story. I have been fed. When I got sick, I didn't have then NHIF, now SHA. So that is why SHA is very important to us. We pay SHA for the patient. Number two, we give them food, because when I got sick, I didn't have food. Yeah. We give them accommodation to make sure they have places to sleep, because I was housed by my sister for 2 years. You know, we start for them small businesses, because I have been sacked with no source of income, with children to feed, all these things. And I stayed for 2 years without going for a biopsy, because I could not afford even to see a consultant. So you understand, it is organization behind my story and my life. So yes, stigma is real. The cost of living after survival is real, because right now people see us now with red lipstick, and everyone say, oh, the other day my brother was telling me, I said, Ken, why don't you people ask me how I am? They said, but we see you on social media, you are so fulfilled, you are so happy with red lipstick and eye use. I said, man, you don't know the struggles behind this.
And I want you to just hold that thought there. We go for a short break, and then we'll come back and continue with that. Don't go too far. We'll be back in a moment. Welcome back, and thank you for staying with us. In case you're just joining us, our conversation is on cancer care and the cost of survival. Before we took that break, we had the story of Eunice and Nana as well. And something that came out from that story is the fact that we are having late diagnosis when it comes to cancer. So I'd like to hear from you, Edgar. Maybe could you be having the data on that, so that we know, is this actually the case, or this is just what is coming out of the story we have here today? Do you have the data on diagnosis and cancer in general?
Yeah. When you look at the research, we'll tell you that around 40,000 there are new admissions of cancer. 40. Annually. Then out of the 40, we have about 29 cases that may survive. The mortality rate, sorry. We lose about 27 to 30. So you realize that... Is
that 27 to 30,000 or 27 people?
I mean, we are about 40 new cases every time.
40,000? Annually. Okay.
Then, most likely, between 27 and 30,000 are lost. Those are mortality cases. It's because the reason being late diagnosis. And why late diagnosis? In most cases, we realize that these patients have other barriers to medication. We have cultural beliefs, we have myths. Before even we speak of financial burden, there are other impediments. Maybe geographical location, where especially those whose homes are in far interior, they even don't have information. Maybe they have been going to the nearby clinics for their treatment. By the time they're knocking at the door of the hospital, they're already late. And remember, once the patient has come late, once we have we've recorded late diagnosis, already it attracts treatment on burden, because there's no option. The options for treatment are narrowed down, and most likely now you see that we have high mortality rates. I think that is the reason. So what is our role as healthcare providers? Is to ensure that people have been, a creation of awareness has been done to the community through the CHPs and CHVs. We have had partners in the rural areas who have been empowered, capacitated, who understands, who can read the symptoms, then can help in referring the patient to the facility where they can get their diagnosis. But again, the challenge becomes we have very few healthcare providers with active treatment. Like now, I'll make a reference to no thrift. We rely so much on MTRH. So MTRH is serving even people beyond the boundaries to swam from Uganda, Bungoma, those part of Western, plus the North Rift and even the South Rift. So you get that burden alone again, it will result to late diagnosis. A patient will come today, will not get the diagnosis, go back, come again, go back. That navigation also becomes results to late diagnosis.
Yeah.
So by the time the patient receives the diagnosis, it's already late.
It's a bit late.
Yes.
Yeah, and even just going by the numbers that you have pointed out for us, like that's just such a high mortality rate.
Great,
and actually, cancer is the third leading cause of death in this country, and that actually proves that. But maybe, you know, we need to look at ways in which maybe we can be able to reduce this number. Is it possible for us to reduce this number? Is it doable?
It is. I think it is because, number one, when you look at the common kinds of cancers, we have breast cancer, we have cervical. For women, the leading one is breast, followed by cervical in Kenya. But for men, it's prostate. But cancer of the esophagus affects the two genders. And although it is high when it comes to men, so it means also lifestyle. I want to point out about the issue of lifestyle. The way we live, the way we conduct ourselves can also contribute to these numbers. Then as I talk of cervical cancer, then we have vaccines. The government has always been, or the Ministry of Health has always been encouraging people to go for early screening, which also can help in reducing these numbers. Early diagnosis will always result into cheaper medication. At least it will reduce the treatment burden. And also will give an open door for treatment options. Yeah.
All right. Eunice, what went into your cancer treatment?
In terms of cost?
Yes.
So far I've spent over 10 million.
Over
on
10 million.
in the last 10 years. So what have I learned? The cost of cancer is very expensive, but if I had been diagnosed the year I felt the lump, I strongly believe the cost would have been a bit cheap. But why did I not get diagnosed? I can blame the doctors as much as I wish, but I'm a believer in my health is my responsibility. So lack of awareness made me reach where I am. So I'm a very great cancer advocate. I do a lot of cancer advocacy. Because there are so many myths and misconceptions associated with cancer. Let's say like HPV. HPV is a vaccine that can prevent cervical cancer. It can prevent anal cancer. It can prevent several, like 5 cancers. But when you go to the rural areas, you find a CHP saying that I'll tell them to take their children for vaccination, but I cannot take mine. Reason being, they believe that the government is doing family planning. But once bitten, twice shy. If parents would know the much I know today, because watoto wako nyumbani for the long vacation. Previously we were doing between 9 and 14 years, but the current instruction inasema 10 years. But they are still catching up now when in case walikuwa wamebaki nyuma. If people would prevent cancer, the cost of treatment would go low.
Speak to the parents and guardians watching you right now.
Yes, I'm saying if people would prevent cancer, the cost of treatment would go very low. And cervical cancer, in fact in Kenya, 9 to 10 women die on daily basis because of cervical cancer. And when you get that math, it comes to over 3,000 women in a year. And when those women are dead, their children are left without mothers. They are left orphans. Most families, you find that they are single-parent families. Those children are left desperate. So parents, please take your daughters 9 to 14 years for vaccination.
And it's free.
And it is free,
Yeah.
even if you don't get it at your nearest facility. Ask from that facility where it is available, and it will be. And these days it is being done at single dose. It is no longer 2 doses. With 1 dose, you are sorted for life. So please, parents, it is not. The vaccine is very safe. It has been done in the Western countries, and in fact, they've eliminated what we are dealing with in Kenya.
Yeah.
So please, parents, take your daughters for vaccination. There are those who ask if boys can be vaccinated. Yes, you can take your boys for vaccination, but the daughters are more at risk than compared to the boys because the daughters have the cervix. So please, the best we can do for our country is to help one another, prevent. And another thing that people take for granted, exercise. Your lifestyle is a contributing factor. It is a risk factor for cancer. So especially those people who live in urban centers, take some time, do some exercise, walk around, just don't sit there all day. All of us are at risk of getting cancer. In fact, as we are running a charity run that will be happening at the Current there on Sunday.
Yeah.
And as I was contacting people from our contacts, there are those people whom you could call and tell you they don't care. There are those people whom you could tell them and tell you, I've never heard of cancer, and I wonder where they live in Kenya.
Yeah.
So what am I saying? Cancer is real. And when you hear anybody talk about cancer, take 10 minutes, 5 minutes, and listen to what that person is saying. Because when it gets into you, into your family, it comes with a lot of financial implication. So it is real.
Yeah. And, you know, just from what she's saying, it is actually real. You know, especially when you get to experience it, maybe not yourself, but even by having a family member who has this condition. So what does a cancer diagnosis really mean beyond, you know, the patient, beyond the person who has this diagnosis?
So literally it means a whole problematic life for the patient and the people who are concerned. Every day when we wake up in our office, we all have one focus on eliminating poverty and heal health, which has been brought about by this diagnosis. Because our children are suffering, our relatives, the ones who care, also feel a lot of heat. Leave alone that cancer is a family killer, because after survival, after diagnosis, the people like us who are in remission, life is never the same again. There are so many heavy unspoken things which we cannot talk in public, but which are really, really, really excruciating. So, as Edgar said, I need Kenyans to know that every day, according to National Cancer Institute Kenya, we have 125 new diagnoses of different cancers, from children to adults.
Every day.
80 deaths daily. What does that bring us to? Can we please go for screening? Can you please go for screening, my fellow Kenyans? We need to stop this madness of the problems which I don't know does not affect me. Let me tell you, if that problem gets you at stage 4, you will be in for a huge surprise. Let us, women, mammogram is every 2 years. If you are 35 years and above, every 2 years go for mammogram. Cervical screening, pap smear, once every 3 years. But if you're HPV positive, you go once a year. For men, prostate screening is once every year. I'm telling you guys, screening is a game changer. Screening is the in thing, and if you are not screening, then you are signing a very, very sure death warrant. Go for screening. This is what only thing which is going to help us, and stop prescription, because something like stomach cancers are coming in form of H. pylori, acidity, you know, discomfort, I don't know, constipation. If you have those things, please go to hospital. As she said, diet, 79.9% of NCDs, non-communicable diseases, are diet related. Yeah. Why are we eating as if our bodies are dustbins? This is the only body that you have, and this body has no repair. I'm telling you the truth. She can tell you because she has been. I can tell you our lives are never the same again. It is costly to be sick. It is very expensive to maintain being a survivor. Please take care of you. Let's go for screening. Let's stop stigmatizing cancer patients. Cancer si uchawi. Cancer si kurogwa. Na kansa ifashiki watu wale wamefanya madhambi mingi kushinda wengine. Cancer is real, fellow Kenyans. Cancer is so real. You could never believe it. 125 new cases daily. It is no longer a laughing matter. Let us take care of ourselves.
Yeah.
Yes.
Edgar, what goes into being a medical social worker in an oncology institution or setup and that palliative center? What goes into that?
What? Pardon?
What goes into being a medical social worker in that space?
As a medical social worker in that space is basically is to empower the patient. And you see, right now we have changed the treatment approach. We are not concerned about the patient as per se, but we are saying where did the patient come from?
Yeah.
From which environment? What kind of environment is this patient coming from? Because even after treatment, they are going back to the very environment. So my role as a medical social worker is to ensure that the patient has received treatment, but again, goes back to the community or to the social environment which is conducive, which can help her or him to adhere to the treatment process. Like the patient should be able to, the patient and the caregiver should be able to know the pathway, treatment pathway, at ease, not by difficulty. They should know where they are supposed to receive such particular treatment at what time. So my role is to just make a follow-up that the patient is comfortable. I have improved the quality of life of this patient together with the caregiver. Remember, when cancer knocks at the door of that family, it affects, it dismantles the whole system, financially, economically, even love affair will have, even the bedroom issues will be affected. They will tell you, how do a cervical cancer patient satisfy herself? It is something that should also come out. And when we speak of the cost of survival, those are the costs of survival. So that is what we try to put in place. The patient has been able to navigate the pathways to the treatment destination, but again at ease. Then now, at ease means we cut the costs.
Okay.
If I've been able to empower the caregiver, instead of the patient going to the facility at the far end, she's able or he is able to get the services or the care from the caregiver. Kwa mfano kama kuna hitaji lolote lenye patient angeendea dawa, patient caregiver ataelewa. Hizo costs zitakuwa cut off by merely going at the nearest facility, atapata morphine na rudi.
Okay.
Yes.
Yeah. Eunice, from your point of view, from your experience rather, would you say that cancer care in Kenya is accessible? Just from what you experienced with cancer, is it accessible?
Depends on where you live in Kenya. If you are talking about Nairobi, in Nairobi it is accessible. When immediately after you leave the outskirts of Nairobi County, cancer care is not accessible because 90% of people have been coming from all over and coming to Nairobi for treatment. And let's say like when you go for the outside cancer centers, especially the government cancer centers, let's say like in Machakos, they still refer to Nairobi. They'll do chemo, they'll do some tests, and then tell you whatever you need to do after that, it's not within our reach, so they refer you to KNH. KNH still has a lot of congestion. So per se, cancer treatment is still not accessible. And that is the reason as to why people are dying at home.
Yeah.
Because like 2 weeks ago, I was at home. I met this guy. He went to Machakos level 5. He was referred to KNH. He came to KNH once. He missed the appointment. He was given an appointment of like 6 months afterwards. He asked Joe cancer. In 6 months' time, where will he be? Yeah. Soon and very soon he'll become part of the statistics. So still. And then another critical thing that people don't understand. After treatment might take you 10 years, 15 years. There's a lot of life after that. And if you are employed, you've been dismissed from work, maybe you were married, your spouse has left you, you were in a family, they felt that you are burdened because of the cost, they left you. So you are left on your own. Nobody is willing to employ you, nobody is willing to be associated with you, and that is the reason as to why personally I became a member of this organization. Yeah. Because in this organization, we are so many of us who have been through the journey and they understand the journey. And through the funds that we are raising, maybe like now the run that we are having on Sunday, that will be happening at the hub in Karen, which I would wish all of you to support us. Through the money that we'll make that day, we'll be able to start small businesses. At least to know when you do something for yourself, your life has meaning. And it gives you a livelihood. Because since you have cancer, does not mean your life ends. There's a lot of life after cancer. And because you are sick, you will not avoid your responsibilities. It does not mean you will not take your children to school. It does not mean you will stop eating. If you are paying rent, it does not mean you will stop paying rent. And you will also have to go for clinics. When you go to the clinics, it's not free of charge, you pay. So, through the initiative, we are able to support the view that we are able to support because there's a lot of life after cancer. The treatment takes a short duration of time, but survivorship. In fact, in Kenya, nobody talks about survivorship. In fact, when I went for treatment, my doctor told me the diagnosis, the steps of treatment, but she never told me there's something that is going to happen after I finish treatment. Yeah. Another thing that most doctors don't factor into account, psychological support. Psychological support. Yes, you've been diagnosed with cancer. What next? Okay. What are you telling yourself? In fact, 10 years later, where I come from, there are people who still don't talk to me because according to them, I'm supposed to be dead. You cannot be diagnosed with cancer and still be alive. They point at you with their tongues, not using their hands. What does that one mean? They feel you are a bad omen in the society. Even the churches that you go, there are those who will tell you, come pray for us. That demon you have in you, ikutoke. And surely cancer is not sad. A demon. Yeah. So that is the space personally I've been in. But I thank God for the far He has brought me. Yeah. So survivorship is also a journey. And it comes with a lot of stigma from everybody. So it's not easy. Yeah,
I realized you wanted to add on to the accessibility of cancer care while she was speaking. So Edgar, you can get into that.
I think we have less than 5 active treatment.
Less than 5 all over the country.
MTRH, KNH, University, KU. I think those
Garissa,
are Garissa,
Mombasa,
and Mombasa. So, and sometimes, you know, you can go into those treatment centers when the machines have broken down. It means the patient has to go back. Yeah. Now, Eunice has talked about survivorship, which is very, very critical area of where now a healthcare provider. Because the work of an NEMO is just to diagnose the results. But it is my role with the multidisciplinary point that we will explain, we will define the diagnosis. Because even at that point, if you don't define this diagnosis properly, the patient will go and as she goes. Ataenda kama ameenda kabisa. But it's now my role to bring them together as a family to understand the diagnosis and to understand the journey. If you are going to Nairobi, you now have to budget for that journey. That is where we come in. Yeah. As a patient and as a caregiver, they suffer we call them total pain. We have spiritual pain. She has talked about the pastor saying it's the demon. We talk about the emotional pain. You've lost your responsibilities in the family. You feel you are displaced. That is emotional pain. Which they suffer psychological pain. What next? Who will be caring for my children? Who will be going for shamba? You know, we have socioeconomic pain because it has eaten the pockets. It has teared the pockets. You sold everything. Then now we have that physical pain, the pain that calls for morphine, of which even the morphine itself is rare to get right now. You get. So they go through what we call total pain. And that's now where we bring in the multidisciplinary team, so that the MO can, the CEO, the MO can sort, the pharmacist can sort the other part. Then the psychologist can sort the psychological part. The social worker can sort the socioeconomic part, and even the social issues like now emotional, the cultural barriers and all that. That's what we are trying. I want to acknowledge the roles that are being played by KEPCA.
Okay.
They are training healthcare providers. Whether you are a medic or not, at least any moment you are associated with the patient, you are trained to understand what this cancer is, so that in case of anything, you can do what you can do, so that you leave what the doctor can do for the doctors. It also cuts the cost.
Okay.
Yes.
Yeah. Nana, you know, when we call you a cancer warrior, sometimes we may not know what it means to be that warrior, you know. So, and she's touched a bit on survivorship, and he has too. So just from your encounter, what does it take, you know, to be a survivor? You know, it is now, you have lived it, you have gone through the management of it, the treatment part of it, the cost, and everything else that we've talked about. But what exactly does that, carrying that title of warrior and survivor, come with?
So, first things first, let me hand about the statistics, because the cancer inequities in Africa are not accidental, they are systemic. It's what she said. He has had Joe cancer, and he has been given appointment 6 months after. That person cannot survive. So the inequities are systemic. You understand what I mean?
Yeah.
It's the accessibility, which is not there. So what does it cost to be a survivor? Number one is the acceptance. What we do, and what me, Eunice, and others have trained ourselves is, we accept that we have a problem and our lives will never be the same again. Number two, the people who are able to support us, strangers, family, friends, we let them support us. We tell them where we are coming from, where we are going, and the challenges that we are facing. Number three, we accept that God is our healer, and God heals and heals completely. And the last thing is, you have to wake up every day. Me, Eunice, and others wake up every day knowing that we are in a battlefield. Ni kama Israel na Iraq. Ukifanya hivi umepigwa bullet ukakufa. So you have to attend your clinics, take your medication, exercise, change your eating habit, stress management, because adult cancers are 100% stress related. So people need to know that. So to ours, we're in a battlefield, and we have accepted that. So it is you to wake up as an individual and fight for you. This is why this space no longer feels like abandoned. It no longer feels like, you see, even if you wake up in the morning and tell me, but cancer iponangi kabisa, it is well and good. It no longer feel unsafe. It is safe for us. We speak to ourselves and we are fighting on.
Yeah.
Yes.
Yeah. And I would not want us to finish this conversation without, you know, we've touched yes on the stigma, but maybe how do we change that? Because, you know, you've spoke about it, even mentioning that you've lost jobs due to stigma. So just how do we change that story for cancer patients and survivors?
how we change that is through awareness. There's no any other way. People need to understand cancer is real and cancer can touch everyone. Also, people need to understand cancer si uchawi. Also, people need to understand that there is life after cancer, as Eunice said. We are human beings. We are just normal human beings. We are under treatment, yes, but we are normal human beings. And also, people need to understand that cancer is preventable because 80% of adult cancers are preventable. People need to understand that cancer is extremely treatable, cancer is curable, and cancer is manageable. Yeah. There are people who have lived 30, 40, 50 years after cancer, and employers. And I'm addressing this to both private and public. Tafadhali, stop chasing people away after cancer diagnosis. Nobody is an island. Let us accommodate people, understand where these people are coming from, as Endika has said, and support them. To the relatives, to the spouses, me and Eunice, we are examples of people who have been left by spouses just because we got sick. But what happened to the vows of for better or for worse? What if you get sick? Please, let us all accommodate others. Relatives who have people who are sick at home. Pelekeni watu hospitali. Wacheni kufungia watu kwa nyumba. Mkisema kansa ni uchawi, ati mtafilisika. Please take people to hospital. And Kenyans, let us also stop lying to others as herbs can cure cancer. It is a lie. Cancer is lethal and cancer needs lethal treatment. We have to do conventional medicine. You have to go for chemotherapy. You have to go for radiotherapy, surgery, and all these things doctors are saying. Because doctors are the experts. Please watch an in Angata Press. Herbs cannot heal cancer. It is a lie. You can just do, maybe after the main treatment, come and you have to do research on which herbs you are taking. And that is why we have so many cases of kidney failure, because people are taking everything and anywhere, and there is no research. Yes. Yeah.
Now, you know, it's good that you have talked about this, because I feel like there's been conversations around, you know, there are things you can take, there are herbs that you can take and you might be okay. So it's good that you are speaking against that, because, you know, even looking at what we've mentioned in terms of accessibility to cancer care in this country, it's very minimal. Unfortunately, it's still minimal, and it's something that is still being worked on. So I'm sure for someone who's in this interior place and they're being told the herbs can work, they would go for that, because they're wondering, if I look for, you know, proper healthcare, where do I even begin? If, you know, the hospital that they can get access to this is maybe miles and miles away. So it's good that you're talking about the fact that just go to hospital, find a way to just go to hospital. And for the relevant authorities, I'm sure it's something they're looking into, it's something they're working on. And even talking about the cost, maybe Eunice, you can speak on that a bit. You know, does the social health coverage in Kenya cover for that, you know, SHA, that's the social health insurance?
Personally, when I was started treatment, we were using NHIF. And to me, NHIF was a better system than SHA. But despite that fact, SHA still supports. Because SHA pays for every diagnosis per year, 800,000. But when you compare the cost of cancer treatment, the whole cost of cancer treatment, and the amount of the government that is giving us, that is the share coverage, it is just but a drop in the sea. But it is better than nothing, because it has really, personally, I've taken medicines for the last 10 years.
Without having to pay out of pocket?
I've never paid cash. NHIF used to approve it for me. SHA still approves it for me, because I defaulted treatment for like 2 years after I had an accident. So I'm still on treatment. I'm still on the medication for breast cancer. So the government is really doing something with the 800K, but it is not sufficient. Like for my example, before I started treatment, I did diagnostics that cost me like 200,000. Bone scan, PET scan, CT scan, biopsy. I cannot even name all of them.
Yeah.
And when you factor into that, and the amount of money that has been given to diagnostics, it's not enough, but it is better than nothing.
All right.
Yeah.
I want to read some of the comments that are coming in on the same. Remember, if you have any question or comment on the conversation that we're having today, you can be able to send us a WhatsApp message through the number on your screen, 0707303212. Someone here is saying, thank you for enlightening us. May God bless you. Good morning, Kenya. We also need to talk to men out there about breast cancer. Most men are scared. Lack of knowledge or ignorance about men getting breast cancer is something to be talked about. All right. Another one here says, what is the best diet for cancer patients? Maybe Edgar can get into that. And another one here says, how is asking a question, and they're asking, how frequent should one go for tests for both genders, and how much does it cost? Edgar, maybe if you can speak, maybe you can speak to the men about breast cancer, because it can get both genders, yes, and then talk about the diet, the diet that cancer patients should follow.
Okay. Okay, thank you once again. The statistics will show that breast cancer for men is about 1% in Kenya. It's not so high, but again, we should not just overlook it. It's good to go and be free, and be free completely. We have one case as far as Trans Nzoia is concerned, which we are doing a follow-up on it for breast cancer for men.
Okay.
Of all the numbers, we only have one.
Okay.
Yeah. Now, when it comes to nutrition, I always like to be open about what I do and what we have. This one requires a lot of speciality. So it is, I leave it to the, maybe one time you will invite the
nutritionist for that specifically. All right.
Yeah.
Okay.
Because I don't want to say something which will confuse people.
Yeah.
Yes.
There's the person who had asked about the tests and how frequent we should be going for these tests for both genders. But I believe you had touched a bit on that.
Yeah,
You had talked about it.
Yes.
So maybe they missed it. If you can just...
So I said for women, for pap smear is once every 3 years. Then if you're HIV positive, it is once every year. For breast cancer, mammogram, it's 40 years and above, and it is once every 2 years. And for men, for prostate, a PSA screening is once every year. Yes.
Okay.
Yes. And if you have a stomach problems, the H. pylori, the bloating, the acidity, you know, the bloating, constipation, please talk to your doctor and make sure you do some endoscopy or colonoscopy. But tafadhali, just do some serious screening. Yes.
Okay.
Yeah.
Let me read 2 more. One is saying, any preventive measures that we can take or use? And then someone here is saying, does our lifestyle contribute to getting cancer, like the air we breathe here in Nairobi or the food we eat mostly in the city? Her name is Sylvia. And then Peterson from Meru is saying, we are being told that our country is leading with cancer illness because of the toxins in the water we get to drink. Is it true? And if so, what can we do? I don't know if that can be backed.
I think in fact, I would wish to say that let us focus so much on research, evidence-based things. Let us not just speculate things.
Yeah.
In medical setup, we say disposal factors, because cancer does not have, we don't have 100% of certain causes for particular cancer type. So we say there are disposal factors. But it is very true that people who smoke are they have high chances of being affected by cancer of the lungs and all that. But there is new things requires new knowledge. We should not just be seated somewhere at the fence. It concerns all of us. Let us do research and let us be led by the research, the evidence-based outcomes.
Yeah, and still on the same, because there's a question on that, as we finalize on that bit, there have been conversations that, microwave rays also contribute to cancer, and as well as the UV rays that we women use when we go make our nails. Is that supported by any research?
Yeah, there are researchers. These things, we call them the radiations
yes.
within our environment. Especially if you're now going for, I'm just making an example. If you are going for an X-ray with a ring on your
finger,
or earrings, of course it will sense and na itakuleta shida.
Okay.
Over talking on the phone for a very long time. These things are artificial. They're made by human beings. Don't forget that when they are doing business, they don't mind about how many will die. For their major goal is just to get the income. Sasa ni wewe ndio utajichunga. It's up to you to take care of yourself. I will also mention about food. Food, the kind of food that you eat, you take in, matters a lot. Yeah.
Okay.
Let me touch something on preventive measures,
Yes.
Because as we're saying, of course, diet is a really contributing factors, but then there are other things which you can do to prevent this, because let's say, for instance, 99.9% of women who have been diagnosed with breast cancer had a deficiency of vitamin D. What is vitamin D? It's a sun. So people need to take care of their diet. We need to walk, because when you walk, you exercise your entire body and you breathe in a lot of fresh oxygen, especially outskirts of Nairobi. And cancer cells never survive on well-oxidated bodies. We need to bask on the natural sunlight, We need to stop this thing of smoking, drinking, too much stress, multiple sexual partners, because again, what is HPV? Virus. It's a virus which is carried by men and sexually transmitted. So what does that mean? So really, there are things which we can also do to reduce the risk, countercheck the risk factors. As human beings, because these things, we know them, we are aware of them, so let us focus also on these matters. Yes.
Someone here is asking, how can one join your organization? I believe that's the Needy Cancer Health Initiative.
Oh, okay. Fine. You can go to our social media pages. We are on Facebook, we are on Instagram, we are on TikTok, and we have our website, www.needycancerhealthinitiative.org. We'll get our contacts there. So once you send the message, it will be responded to, then we'll guide you on how we are going to join.
All right. Let me read one more. What are some of the major myths about cancer and survival? I'm sure you've touched on that a bit as we were going on. Is there anything else you wanted to add on that?
Yes, that cancer si uchawi. Cancer is not witchcraft. It is a disease like any other. Go to hospital. Yes.
All right.
Cancer is not a curse.
Yes.
Okay.
It is not a punishment. You are
It
being
is
punished.
not. We did
God
do
forbid,
nothing.
but let me tell you something.
Yes.
When we are saying you've been diagnosed by cancer, do you know the person who has broken that news can die the next day? This person who has been diagnosed with cancer. It is God who determines who die first.
It's not a death sentence.
Venye tumeka hapa ni nani wa kwanza, you can't tell. So cancer is just like an accident that has happened in life, but can be you can, with resilience, you're able to go along with it. Yes.
All right. What does dignity look like for a cancer patient? What does it look like?
Dignity looks like, dignity feels like being able to access treatment, being able to have food as you go through active treatment, being able to afford accommodation, being able still to have your children go to school, and being able to be treated just like any other human being who has had malaria, treated and is well, or someone who has diabetes who is still on medication, someone who has HIV still being treated well. That is what dignity means to us. So we need to be treated like everyone else in the society. That is what dignity feels to us. No more, no less. Na mwache kutufukuza kazini.
I second that.
You know, with research, we are focusing on policy adjustments. I've said the new things requires new approach. You can compare the life we lived long time, you go and read the current society, contemporary society. So we have to adjust our policy issues to align with the needs of the patients, especially under the health service provision. So I support the universal health coverage. They bring in new alignment of the policies that can at least help even the access to this critical treatment that we are talking about.
All right. As we almost come to a conclusion of this conversation, how important are community-based initiatives and initiatives such as, you know, the Needy Cancer Health Initiative? Just how important are they? Eunice, I would like you to answer this. For someone who's going through cancer treatment, for someone who's a caregiver to a cancer patient, and for a survivor and warrior, how important are these communities, or is this community rather?
These CBOs are very important. Reason being, especially immediately after diagnosis, it shatters your world. And at times you feel that you are the only person going through that. When I go to me as a person, when I was diagnosed, I never talked about cancer to anybody for like 5 years. Reason being, I was bitter with it. I frequently questioned God as to why he allowed it to happen to me. And I did not really know. In fact, I waited for death for the 5 years. Because I had been conditioned by the society that after cancer I'll die. In fact, I remember I used to wake up every day morning and pinch myself to confirm that I can still feel pain. And it took a toll on my emotional status of being. So these CBOs are very important because they give you a sense of belonging. And for sure, one thing I've come to realize, a person who has walked that journey will understand you in a better way than a person who has not walked that journey. Because when I call Nana in the morning and tell her, my friend today, sina nguvu, I don't feel like doing anything, she'll understand. But when I call my employer and tell him, siski kufanya anything, I'm in a lot of pain. Because it's okay. By the way, we are among the few lucky who are there. Because if with a diagnosis of around 45,000, when 30,000 die, how many are left? In fact, I call myself a hero because I'm still here, despite the many challenges that I have gone through. So these CBOs are very important because on top of that, we take awareness to the community. I once went to Garissa to train CHPs about cancer. And when we were training, I told them I'm a cancer survivor. But they were like, people don't survive cancer. So, but when you are able to confirm to them that you've been through it and you are still here, people believe you more.
Yes.
even
you're
more than
giving
a
hope.
doctor
Yeah.
who is telling that person. And we are also able to support those who are newly diagnosed. Because cancer diagnosis comes with a lot of stress, a lot of trauma, a lot of, it affects you psychologically. And also, we go to the grassroots and do awareness.
Which
And
is
we
very
also
important.
support people in
And
the
screening.
ground.
Okay.
And screening, because that is the way we are going to prevent.
All right. I want us to finish. So I would like for you, in very few seconds, speak about the charity run for those who would like to come on board and assist.
So, so thank you so much. We have our third edition charity run on 23rd of August at the app Karen. We will be doing this for the vulnerable cancer patient to raise funds to continue supporting this program through their SHARP program, food feeding program, survivorship and livelihood. So if you want to support us, please, again, we are on social media, Facebook, Instagram, TikTok, Needy Cancer Health Initiative. The registration is only 3,000, and you get, of course, a t-shirt, bib, kit, mendo, and all these things. We have a pay bill, and our official number is 0727 735 306. 0727 735 306.
Thank you so much, ladies and gentlemen, for joining us for this conversation. I am sure that you have gotten to restore hope to a patient who thought that there was no life after cancer. For them to see you here and seeing you all strong, I am sure you have restored hope for them. And thank you for the work that you're doing as well, Edgar. And this is where we get to end this conversation. Thank you so much to each and every one of you who has engaged with us.